Most patients would like to know how a hip replacement is performed. There's lots of information on the internet and lots of videos of surgery that you can watch. Many of these may be different to how that's actually going to be performed for you, as there are a number of different ways of doing hip replacement surgery and different types of implants to use. I can tell you about what I would use in most of my cases using the x-rays that we have here. On the inside, we will make a cut across the neck of the femur. The ball of the femur, or the head of the femur, will be taken out and disposed of, as it's no use to you anymore. The socket will then be exposed, and we will make that socket a little bit deeper and a little bit wider. That will allow it to accept a titanium alloy socket, such as this one, which is a titanium socket made by a company called Stryker. That has a highly textured backing with an option for screw holes. We line that up with your socket, as is appropriate, and that's impacted into the bone and initially grips with what we call a press fit. Over the course of the next 6 to 12 weeks, the bone will grow into that textured backing so that your bone actually bonds to the socket. On the inside of that socket, we put highly engineered polyethylene lining, which locks in. This is like the new cartilage in your hip joint. When we turn our attention to the femur, which is the thigh bone, we make a space in the marrow space inside the bone, and into that we'll pressurise a acrylic cement into all the honeycomb spaces in the bone. That cement starts soft, and then over the course of 10 minutes it will go hard. Whilst it's still soft, we'll put in a metal stem which is made of stainless steel, such as this Exeter hip replacement. That slides down into the marrow space with the cement, and over the course of about 10 minutes that will go hard. Once the cement's gone completely solid, we'll then apply a ceramic ball, such as this, and that ball will go into your socket like so. You can walk on that the same day that it's done, and it's absolutely safe for you to be mobilising as soon as your anaesthetic is worn off. We encourage you to walk on the same day with a view to going home the next day.